My name is Professor Jeremiah Seni. I'm an associate professor of microbiology and infectious diseases at the Catholic University of Health and Eye Sciences, as well as the Bugando Medical Center, which is a tertiary hospital in the northwestern part of Tanzania. So I've been in this institution for the past 15 years, and my area of focus, as I've said before, I work on those two major fields, so like microbiology and infectious diseases. So specifically at this hospital, I lead antimicrobial resistance surveillance team, so I'm the lead. Bugando Medical Center is one of the 10 sentinel sites for National Action Plan on Antimicrobial Resistance Surveillance. So it's one of the sites, and I lead this site. And I'm also a co-lead in the COVID-19 Epidemic Preparedness and Response team at this hospital as well. So basically, as I've said before, we have been really working under supporting the National Action Plan on Antimicrobial Resistance. This is the project that has been taking place for the past, I think 4 to 5 years now. And the aim of this project is to support the National Action Plan on Antimicrobial Resistance, which started in 2017, and we're looking forward to end around April 2022. So our project basically, we are focused on all the strategic objectives which are stated in the National Action Plan, making sure that as a country or regional-wise, we curb the escalating burden of antimicrobial resistance. So antimicrobial resistance, it is a threat. It's a global burden, which is now we are seeing its impact. We are seeing this burden trickling down all the way from the national level, regional level, district, and all the way to the community level. And we are really concerned because if we don't take responsive initiatives, then probably the antibiotics that we are using to routinely to treat various infectious diseases, I think that at a point maybe in the future, they will be totally ineffective. And it will be the time when now even a mild infection like an abscess can lead into death. So that's why we're really concerned on this, and that's why we are joining our efforts to make sure that this burden of antimicrobial resistance is tackled from different angles. You may be aware that the World Health Organization issued a global report in 2014, which say that all the nations across the world, all the countries should actually generate their national action plan to combat this problem. And we as a country, we also started our own national action plan in 2017. And it has been, we have been really implementing this in 4 strategic objectives. So the strategic objective number 1 is on the awareness. So like education, the issue of advocacy, the issue of information. The second one is on research and surveillance. And then the third one is on infection prevention and control. The fourth one is on antimicrobial stewardship. So basically, these thematic area or strategic objectives, they triangulate to one another to make sure that we tackle the burden of antimicrobial resistance from different angles. So if you look on the global picture, it is projected that if you don't do any intervention, by the year 2015, approximately 10 million people will be dying from antimicrobial resistance attributable infections every year across the world. And the pinch will be mostly felt from low and middle income countries. And that's why we are really in the forefront to make sure that we devise strategic interventions to make sure that we really curb this problem. If you look, we don't have really unified data across the country in Tanzania when it comes to the burden, because we had recently started the nationwide surveillance data. We have recently started collecting the data country-wise. But we have still some information from research that we have been conducting maybe for the past almost 15 years. And we are really optimistic that through this project like SNAP-AMR, we'll also get some information from lower level all the way to the higher level. For example, if you look at our hospital here, if you go 10 years back, the antimicrobial resistant infection was, the burden was mostly felt among children. And we conducted, for example, one study in 2010, and which showed that approximately 20% of newborns, these are children less than 1 month, or children less than less than 28 days of life. So we conducted a study and showed that approximately 20%, so like 20 out of every 100 children under the age of 1 month, they die due to drug-resistant infections in the blood. And if you look, for example, a recent study that we conducted approximately a decade after that, so like in 2019, the burden is slightly decreased from like 20% to like 13%. But if you look at across other children age groups, so the impact was most felt among neonates. So if, for example, if you look on the neonate, it was like 13% death. And then if you look on those children who are between 2 months and 1 year, so it was like 3%. And if you look on children who are between 2 years and 5 years, so their mortality was, or the death was around 2%, so 2%. And as a result of this, we then refocused, through now the SNAP-AMR project, we refocused our agenda from just looking on all age group. So we are really now focusing on this neonatal group, because that's where the most impact, that's where the most burden of antimicrobial resistant attributable infection is felt. So that's where now we have a number of now responsive actions that we have been conducting. And one of it, as I said before, the antimicrobial resistance, like you need to tackle it from different angles. And we are looking also on different angles to make sure that we tackle these problems. And if you look on the National Action Plan, the strategic objective number 1 is on awareness. It covers things on information, things on education, things on advocacy. So for us, through this project of SNAP-AMR project, so we have started 2 major campaigns. So the first campaign is called the Neonatal Campaign. This is a campaign which is done in wards. So, and it involves, we involve like healthcare workers who are working in those neonatal wards. We are involving also the mothers or the guardians who are taking care of the neonates, and we're also involving the neonates themselves. And our main focus is, 1, to make sure that we strengthen the infection prevention and control, because we know for sure if the infection prevention and control is strengthened, then all these other problems will be indirectly prevented. So we are really focusing on that. So like environmental cleanliness, to make sure that all the bugs which are around the environment are killed using special chemicals, using special disinfectants, and they are cleaned, the environment is cleaned regularly, following the standard guidelines. But also we are training the healthcare workers to make sure that they adhere to the infection prevention and control protocols or the guidelines that we have. We have raised awareness among mothers or the guardians who are taking care of these neonates to make sure that they frequently wash their hands. And we have also provided them with special gowns. So like when they go to those wards, before they enter into the wards for the children, they take off their shoes, they change the shoes, they use the shoes which have been washed thoroughly, they use also the clothes which have been washed thoroughly, they wash their hands, then they go and take care of their kids, and when they come out, they also wash their hands. So I think actually this is the area which we really think that it is in the context of low and middle income country. The best thing is to prevent this infection, because we know once this infection occurs, then, diagnosing them or identifying them is a challenge and it's costly. Treating them is also a challenge and it's also costly. So the only thing that it's within our capability that we can do it in all the efforts that we have is to make sure that we prevent these infections from occurring. And I think the neonatal campaign is really working on this. So we collected the baseline data, we started the campaigns, and now we are looking forward to collect the endline data to see how then this project has reduced reduced the occurrence of these bugs in the environment. How has it reduced the occurrence of these bugs among neonates, among caretakers, but also how have we reduced the infections to these children, which is attributable to these drug-resistant bugs. So I think that's where we have been working very actively for the past almost 4 years in those 3 phases that I've said. The other area that we're also working on the Dala Dala campaign. So this is now targeting the community, So we also target the community, and we sat down with those people who are operating these public transport operators, so like the drivers and their conductors, and we collected some baseline data on the awareness, the knowledge and awareness on antimicrobial resistance, and then we gave them like awareness package. And it was a training, but also after that, we also provided with the physical materials, like we actually branded their daladalas. So daladala is a Swahili word, which means a community bus. So it's probably one of the popular means of transport in our country, so maybe covering over 75% of the population. So we actually branded their buses with awareness, or educative or advocacy messages, and it covers a lot of thematic areas. For example, you can see a bus with a tag which is written, make sure that you get advice from healthcare professionals before you use any antibiotics. The other message is like, make sure that once you take these antibiotics or the drugs, make sure that you complete the dosage, you adhere to the frequency, and don't share those drugs. The other message is like, make sure that you go to the hospital when you feel like you have symptoms which are not usual. So all these are really looking forward to make sure that at the end of the day, if these patients are diagnosed, so they are diagnosed and the disease is diagnosed specifically, and you know exactly what is the organism, what is the bug which is responsible for the disease, and how this bug can be specifically treated. So that's where we are working now. We are also looking forward to do the end-line evaluation to see how has this impacted. We are really optimistic that the Dala Dala campaign may have an impact because, this is a common public transport, and, like one bus carries one minibus, it carries approximately 15 to 20 people per trip. And the taxi carries maybe 4 passengers plus 1 driver. So, and they make a lot of routes. So they make a lot of trips across the city. And we have specifically chosen those taxis and public buses which are coming to Bugando Medical Center. So going across other areas in the city, making sure that whoever comes to the hospital, before that person reaches the hospital, he or she will already get some information pertaining to antimicrobial resistance and how to use these antibiotics rationally. I want to emphasize, from the studies that we have conducted, from the studies across the world, the irrational use, the misuse of antibiotics has been said to be one of the driving force for the bugs to develop resistance. So we are really optimistic that if we develop awareness to these people on how best and when to use these antibiotics based on the healthcare professionals' advice, I think it will really reduce this escalating burden of antimicrobial resistance. And that's where we are focused. So that's a community-based intervention. And the hospital-based intervention, as I've said, that's what we are doing now with the neonatal campaign. Why neonates? As I've said before, this is the most vulnerable group of patients that we have experienced for the past 10 years. And that's why we really want to reduce the burden of antimicrobial resistance in this group, because more kids are dying from these drug-resistant infections. And we think because we have prioritized this, we'll gradually reduce the burden of antimicrobial resistance. Okay, and the other thing which probably is also very, very important, people can ask you, why are we really focusing on, let's say, campaign? Why are we really focusing on advocacy? Why are we focusing on creating awareness? I said we have 4 strategic objectives in our National Action Plan on antimicrobial resistance. And if you look on all these other strategic objectives, they translate into awareness. They translate into advocacy. For example, if you do a research or you collect the surveillance data as one of the strategic objectives. So they generated data from research and from surveillance that we are conducting in the hospitals. So this data has to be also communicated now back to the healthcare workers and they need to be communicated maybe through policy brief, leaflets, brochures, back into the community. So you do this, so you generate data from research and surveillance, and then you translate them back to be utilized either by healthcare workers or by the community members. And this is through the strategic objective number 1, which is on awareness, advocacy, and education. But again, if you're talking of like a strategic objective number, let's say number 3, on infection prevention and control. So once you generate again data from infection prevention and control, like trends of infection in the hospital, at the end of the day, this data need again to be translated back to the healthcare workers and again back to the community so that people can know exactly what is the status in terms of the burden of infection and what are the cost-effective strategic measures that they can take so that they can reduce this infection. Similarly, for example, if you look on a strategic objective on antimicrobial stewardship, so this is about like rational use of antimicrobial agents. So again, once you have the data on this, and that's what we are doing, that's what we have been doing through the SNAP-AMR project. So this data on how the antibiotics can be used rationally, it can also be taken back to the healthcare workers so that they can know exactly which antibiotics to use, how to use them, and how long to use them. But also the importance of now the patients and people or members in the community to make sure that they adhere to the rational use of antimicrobials. So we have 4 strategic objectives, but these are 3 strategic objectives. Basically, all of them, the output from those, the output from those 3 strategic objectives, they really feed into strategic objective number 1 on awareness. And that's where now we are really involving the community. Otherwise, you can do fancy research, you can do fancy science, but if that science is not translated into the community, if that one is not like, if there's no, for example, knowledge translation so that it can directly benefit the community, I think we as the clinicians, we as the scientists, we as the researchers, I think if you don't do that, then we will not like fulfill our primary obligation. That's why we are really emphasizing. At the end of these 3 years of SNAP-AMR project in our area across the country, we are now looking forward to make sure that all things that have been generated are now translated into evidence-based practice, be it in hospitals or be it in the communities.